Hi to everyone. I am Vijitha Rajakumar. Welcome back to the Vijitha Rajakumar online classes for all my dear students. Today I am going to discuss about the congenital anomalies in the subject of the child health nursing for the MPHW students. Okay, so here I would like to tell one thing. So here already in previous class I have discussed, I have explained in Telugu about this topic only. Now I want to give the content for the English medium students. Okay, so if you have any doubt you can ask in comment box. So wherever wherever you want I will provide the explanation for you people. Okay, so let's we see one by one. Congenital anomalies. Okay, congenital anomalies is nothing but it includes all the biochemical, structural and functional disorders present at the birth. Okay, include only the structural defects present at the birth. Okay, so here the congenital is nothing but at the time of delivery the baby may have the problems. She will deliver with the complications. It may be structural, or it may be functional, or it may be biochemical. If she delivered with the complications of these like a biochemical, structural, functional problems, that time we can call it as a congenital anomaly. If the baby may have the structural defects, so then we can call it as a congenital malformations. You got it my point? If the baby may have the problems in three variations, like in three categories, like a biochemical, structural, functional. So that time we can call it as a congenital anomaly. If the baby may have the only structural defect, we can call it as a congenital malformations. Now we clear? So next how what is the incidence rate, like a problem or like a cases. So if you see the global wise index, like a global wise incidence about 30 to 70% live births. If the baby deliver like 1,000, in 1,000 live babies, there are 30 to 70% cases are there with the problem of the congenital defects. Next in India, 2.5 to 4% of the babies having this congenital defects. Next coming the common type of birth defects is in central. Most of the out of the 100, 22% of the babies may have the central nervous system abnormalities. So this is the etiology. Etiology is nothing but causes, how the babies are having this problem. So most over here the problem is the different symbolical will be there. If you see the 50 to 60% unknown etiology, we can't tell. So this is the reason the baby may have this. This is the reason only the baby may affected. We can't say like this. So many researchers still still he didn't find any problem. Okay, so that is the reason here the 50 to 60% unknown etiology, we can't tell exactly this is the reason the baby may have. Okay, next one is a multifactorial inheritance. It is also like a genes, like a genetic factors. Next one is the 60 to 6 to 7% chromosome abnormalities. Here if the mother may have the advanced maternal age, if she may delivered, if she may conceived at the time of above for 35 years. So that during that time they may have the chromosomal abnormalities. Mostly the baby may have the Down syndrome. Next mutant genes, this is also genetic problem, 7 to 8%. Next one is the environmental agents. 7 to 9% the baby may have the environmental agents. Here the environmental agents is nothing but the intrauterine problems. If the baby is not having the appropriate environment in the womb of the mother, okay, so if in the womb of the mother, if the mother is unable to provide the sufficient environment to the baby, if for example the mother may have the starch is nothing but the STORCH, starch here the starch here. So starch means, S means syphilis, okay, T means toxoplasmosis, okay, TO means toxoplasmosis, R for the rubella, C for the cytomegalo, and next H for the herpes virus. This is the if the mother may have these complications of the infections, so due to these infections definitely the baby may affected. It's clear? So this is the environmental agents, if may inhale the any environmental it may be contaminated air. This is also one of the reasons to get the infections of the baby. So next one is the risk factors. So this is the advanced risk factors means, so if the mother may have this belongs to this age group, so definitely the mother may deliver the congenital defects of the babies. For example, if we'll see the advanced maternal age, like actually the convenient married life or marriage age for the Indian girl is like 18 to 25. So this is the correct age. But if the mother may got marriage at the 35, again she conceived at the time of 38 to 40, so definitely absolutely she may have the chromosomal abnormalities for the baby. Next, consanguinity, okay, like a blood relations, okay. Next, mental retardation. Next, maternal malnutrition. If the during pregnancy time, if the mother is unable to take the sufficient amount of food, it leads to like iodine deficiency or folic acid deficiency. It leads to central nervous system defects like spina bifida and all. Okay, next we will see the etiology. Etiology here the genetic factors. Till now we discussed now like a causes. Okay, genetic factors is the chromosomal abnormalities. I told no, Down syndrome. Okay, trisomy. Okay, next to single gene disorders, autosomal inheritance. In this also dominant traits. If the mother may have the dominant traits, here if the one affected parent will be have this problem, automatically child may also affected. Next one the recessive traits. Both the parents have, automatically baby also affected. Next, X-linked or sex-linked inheritance. Dominant traits, daughter affected. Next, recessive traits, son affected. Next, polygenic and multifactorial inheritance. Combination of polygenic and environmental factors. Next one is the etiology here. The etiology is the mainly environmental. If you see the starch, I told no starch meaning abbreviations: syphilis, toxoplasmosis, rubella, cytomegalovirus, and herpes virus. This is if the mother may have the like infections, obviously the baby may affected. Drugs intake during pregnancy. If the mother may have the intake of like steroids, anticonvulsants like cocaine, lithium, it will also affect the baby. Next, X-ray exposure during pregnancy, maternal disease like diabetes mellitus, CF, endocrine abnormalities, iodine deficiency, folic acid deficiency, malnutrition. It leads to like problems of the baby. Next, abnormal intrauterine environment. Okay, like abnormal structure of the uterus. Okay, the normal structure, normal position of the uterus is the anteflexion. Not other than the like a bicoordinate double uterus. Okay, like a polyhydramnios. So this is also affect the baby. Next, maternal addictions. If the mother may have addicted to the alcohol, tobacco, and smoking, it will also affect the baby. Next, environmental pollution and contaminated air or polluted air it will inhale. It will also affect the baby. Okay, how we can diagnose the problem of the baby at early? Okay, prenatal diagnosis and postnatal diagnosis. If we see the prenatal diagnosis, amniocentesis, so they will examine the amniotic fluid in the womb of the mother. Okay, 8 to 14 to 16 weeks. Okay, so for what is the purpose of this amniocentesis? Like a chromosome, to find out the chromosomal abnormalities and inborn errors of the metabolism. Next, chronic village sampling for cytogenic study. Next, maternal serum alpha fetoprotein gonadotropin. This is to find out the neural tube defects and trisomy of the chromosomes defects. Next, to USG ultrasonography fetal profile to find out the fetal profile completely. Amniography, fetoscopy, and protein assay and DNA diagnosis, radiography. These are all the things for well-being of the fetus. Next, antenatal screening. This is to find out the maternal disease, metabolic disease, and endocrine functionings. Next one is a postnatal diagnosis. After the delivery also we have to find out the history of the mother, maternal and family history, physical examination, biochemical assay, cytogenic studies, blood test, hormonal studies, radiography usage. These are all the things it will helpful to diagnose early. If you will diagnose early, easily we can take the appropriate medications for the baby as well as the mother for the baby for reducing the complications. Next, we will see one by one like a common congenital anomalies here, the like a central nervous system. Anencephaly. Anencephaly is nothing but the small head, like a absence of anencephaly is nothing but the absence of. You will see here, no, face is big, there is no proper formation of the head, isn't it? Next one is a meningoencephaloceles. This is the like a water formation will be there, like a cerebrospinal fluid will be there here, and also like a protrusion will be there. Okay, abnormal structure of the spines. Okay, next one is the central nervous system. Here if you will see the normal shape of the spinal cord is like this, and next here the only one, here the one fusion will be that is called the spina bifida occulta. Little bit here the meninges and little bit layers also involving, that is called as a meningocele. Next meningomyocele, here the spinal cord also as well as some of the layers also involving. Okay, next central nervous system. Okay, meningocele, meningomyocele is a neural tube defects. These are all the things will be there for the baby. Next central nervous system, hydrocephalus. Here the formation of the water like a automatically increasing the cerebrospinal fluid of the baby at the head. So that is the reason the face may small, head is big. Okay, actually normal hair circumference at the time of newborn baby 33, but here the above 33 centimeters will be there. Microcephaly is nothing but the small head. Here the face is big, head is small. Next macrocephaly, here the face is small, head is big. Okay, okay, syringomelia, here cyst formation will be there here. Okay, next one's other agencies of cranial nerves and okay, porencephaly. Here the some of the during delivery process, if the baby unable to come outside during the like delivery process to save the life of the baby as well as the mother, sometimes the health staff also they will take the they will do the like a labor with the help of the instruments. Okay, or sometimes during the uses of the instruments, so like with the help of the instruments, sudden like a fracture, sudden involvement of the nerves involvement of the, okay, some of the sometimes the cranial nerves also, cranial muscles also little bit fracture, little bit injuries will be there. So that is the reason also they are having the little bit problems over the face. Okay, so some of the like internal bleeding also will be there. Okay, these are the some of the congenital heart diseases. Okay, atrial septal defect, patent ductal arteriosus, coarctation of aorta, transportation of great vessels, tricuspid atresia, aortic stenosis, pulmonary stenosis, tetralogy of pallets, okay, mitral aortic regurgitation, dextrocardia, even these are all the things will be there. Okay, so this is this, if you want explaining means here also there is a one like a extra time is needed. So that is the reason I will explain separately. Here the like congenital heart disease, if you see the abnormal tricuspid valve presentation will be there, abnormal small right ventricle will be there, like a hole or defect in atrial septal defect. Okay, here the little bit will be there. Now here the tricuspid, okay, tricuspid valve, here the abnormal tricuspid valve formation will be there, and also abnormal small right ventricle here also, and some a little bit hole in between the atrial septal. So these are all the problems that baby may have. Next, GI system abnormalities like atresia, narrowing of the valve will be there. That is the reason the baby is unable to feed the breast milk. Okay, unable, if she feed also, again it will regurgitate. So due to there is no clear passage of the from up to down. So that is that she may have the sensation of the vomitings, nausea, okay, distension of the abdomen, okay, lacking of passage of the stools. Okay, these are all the symptoms we can observe it. Next one is the GI system abnormalities, pyloric stenosis. Here also the stenosis will be like a narrowing of the stenosis here will be there, no? Okay. Okay, next GI system abnormalities here also. Okay, meconium ileum. Meconium is nothing but the first motion of the baby. Okay, like this will be the ileum. Okay. Next one is the Hesper's disease. Here the all the intestine, megacolon, small intestines of the large intestines, it will come outside like this will be there. Okay, next one GI system abnormalities, examples, gastrocyscus like this will be there. Okay, examples means here the umbilicus, it will protrude outside like this will be there. Okay, here all the intestines will come outside like this, gastrocyscus means. Next one GI system abnormalities, diaphragmatic hernia. Here the hernia will be there. Okay, like the, so due to the different reasons, it will be displacement of the place. There is the Okay, it will come outside little bit. Here the problem will be there at the diaphragmatic region, we can call it diaphragmatic hernia. If the baby may have the umbilical region, we can call it umbilical hernia. Okay, improper placement. Next one is the femoral hernia. Here also in ladies, femoral in groins area. Next one, intestinal obstruction. There is a point of obstruction will be there, like here all the structure will be there. No. Next, corneal atresia here. Next, pulmonary agencies. Okay, like this will be there. Next, here renal agencies. Next, hydro is the formation of the water. So due to the formation of the water, like this will be there. Next, genitourinary system abnormalities, polycystic kidneys. The shape of the kidney is the beans, but here will be like a little bit cyst will be there. So many are there, like a horseshoe kidney. Here also the shape of the kidney is like this due to the congenital defects, hydrospadiasis. Okay, here the actually in middle part of it will be there, but here down will be there, hypo below the okay phimosis. Next, undescended test. There is improper development of the testis. Next, hydrocele, formation of the water. Next, musculoskeletal abnormalities, clubfoot type. Okay, valgus, okay, talcus, like the different positions of the different abdominal positions of the fetus. Okay, congenital dislocation of hip, like this will be there, dislocated hip baby. Okay, next, polyndactyl webbed fingers, like this will be there. Okay, normal nasal bridge, low nasal bridge, like this will be. This normal will be there. Here the low nasal bridge will be there. Okay, Marfan syndrome feet, like this. This is also one of the abnormality. Marfan syndrome hand, here the hand, here the feet. Blood disorder, thalassemia, hemophilia, sickle cell anemia, congenital superstition, like this. Endocrine abnormalities, cretinism, congenital hypothyroidism, insufficient amount of the thyroid production, it leads to cretinism. Hyperplasia, diabetes mellitus, abnormal chromosomal abnormalities, Edwards syndrome, Turner syndrome, Klinefelter syndrome, miscellaneous means other problems, cleft lip, cleft palate, like this will be there. In cleft palate, if the problem will have the only lip, we can calculate as the group 1. If she have the palate region, we can call it as the group 2. If she have the problem with the cleft lip and cleft palate, we can call it as group 3. Okay. So next, how we can prevent this one? We have to give the we can call for the couples for the genetic counseling. We have to communicate properly. We have to explain genetic disorders and congenital anomalies in the family. Okay, and non-direct information to the individual, and we have to discuss with the family members. We have to give the importance to their own situations. We have to give the so many alternations, so many directions we have to give, but we have to give the chance to we have to give discuss the importance to their own situations. Okay, and we have to, we can give the genetic counseling. Okay, and if they have the continuous this type of cases in this family, we have to discourage the consanguineous marriages, avoid late marriages, and avoid pregnancy above 35 years. Promotion of health of the girl child and pre-pregnant health is important. And we have to prevention of malnutrition, anemia, folic acid deficiency, iodine deficiency. So how we can prevent it? By promoting the health of the girl child during her adolescent girls. Okay, and next one, encourage immunization of the female child by MMR. Okay, why means here the measles, rubella is a very complications of the maternal infections. That is the reason we have to encourage the immunization of the female child by MMR. So the actual time for the intake of the MMR vaccine, she has to complete 9 months to 12